IMSPARK, scientific rigor, public trust, and vaccine safety communication. Imagined Endstate. Health journalism and public health leadership communicate responsibly and clearly, ensuring vaccine safety discussions are evidence-based, peer-reviewed, and supportive of community confidence, especially in vulnerable regions like the Pacific. Fiore, K. 2025, November 29th. FDA memo claims to link 10 kid deaths to COVID shots. Expert calls report without proper scientific review, dangerous and irresponsible. What's the big deal? A recent MedPage Today report detailed an internal FDA memo suggesting a possible link between 10 child deaths and COVID-19 vaccination, a claim that experts called dangerous and irresponsible due to its reliance on unreviewed data and the absence of rigorous scientific validation. Health communication carries real power over public perception and behavior. When preliminary or unverified information is amplified without context, it can distort risk understanding, fuel confusion, and weaken confidence in life-saving interventions. This is not an abstract concern. History shows the real harms that can arise when trust breaks down. In 2019, Samoa endured a devastating measles outbreak that claimed dozens of young lives after vaccination coverage dropped dramatically amid misinformation and mistrust. In small island communities and Pacific Island small island developing states, where health systems already operate with limited surge capacity and fragile supply chains, the stakes of miscommunication are even higher. The Pacific should not be a sounding ground for half-formed narratives or speculative science. It is a region where communities depend on reliable guidance, cohesive leadership, and evidence-based public health practice to protect children, elders, and families. The article underscores that linking serious outcomes to vaccines demands rigorous review. Causality cannot be drawn from raw signals or preliminary memos alone. Public health leaders and media outlets have an ethical obligation to ensure communication is grounded in peer-reviewed evidence, transparent uncertainty, and clear context, because premature or sensational claims can inadvertently depress vaccine uptake, weaken herd immunity, and set the stage for preventable outbreaks and loss of life. Responsible reporting in health is a pillar of community resilience, not an optional accessory. Imagine public health communication that strengthens confidence instead of undermining it, where every statement about vaccine safety is backed by peer-reviewed data, clear context, and scientific consensus. When science leads and reporting is careful, communities, especially small and vulnerable ones in the Pacific, can trust guidance, sustain immunization coverage, and avoid repeating past tragedies. Credible science and responsible communication are not just ideals, they are essential infrastructure for healthy, resilient societies.